The Centers for Medicare and Medicaid Services recently released their 2022 Final Rule. In this video, we'll talk about the changes specifically to rural health clinics and federally qualified health centers, FQHCs. And we'll discuss ways that you could prepare for them and how they'll affect your clinic. Hi everyone, this is Dan with ThoroughCare. At ThoroughCare, we specialize in helping groups to manage some of Medicare's most complex programs. Each year when the rule comes out, we like to do videos like these to share our thoughts with you and give advice on how you can prepare for these changes. In a previous video, we talked about the changes to chronic care management, but we wanted to do a separate one for those of you who are RHCs or FQHCs. This year, the primary change for FQHCs and RHCs is around code GO511, General Care Management. And it's good news. The rate has been increased from 2021 to 2022. Let's take a deeper dive and look at that increase. CMS created a code for general care management, and to give a little background on this code, for many years, RHCs and FQHCs couldn't do programs like CCM. But in the previous years, CMS made a separate code for rural health clinics and FQHCs that took into consideration the values of all the other codes on the fee-for-service side and created one specific code that these groups can use. The reimbursement is actually the average of the other codes, the various CCM and PCM codes. In 2021, this reimbursement for GO511 was about $67. For 2022, this reimbursement has been increased to about $76. The time minute on these codes is still 20 minutes, so you can do care plans and log time, and for those 20 minutes, you'll make $76 per patient per month. So this is good news for every clinic that wants to do care management services. So what does this mean for your practice and how should you prepare? Well, the increase alone should enforce that CMS is encouraging rural health clinics and those that live in rural areas to really participate in these programs. Programs like general care management allow you to do care plans on these patients, and the patients really seem to like it, having a dedicated care manager on your team that they can go to. If you've never considered providing these services for your RHC or FQHC patients, this is the best time to do it. The reimbursement's up. You can make a lot of revenue, but you can also see patient quality improvements as well. So we're recommending that any RHC or FQHC begin these programs in the coming year. There's never been a better time to do that. So there you have it. That's the changes for RHCs and FQHCs in 2022. If you'd like to learn more about CMS's changes to other programs, feel free to check out our other series of videos on these topics. There's also a link in the description of this video that will take you to our Learning Center where you can read about this and other topics. If you'd like to learn more about care management software and how it can make your life easier, be sure to download our Buyer's Guide. It's free and you'll get advice on how to manage these programs for your practice. If you have any questions, feel free to write in the comments below. And if you found this video helpful, please subscribe and like this video. This is Dan from ThoroughCare. Thank you for watching.